Good morning, everybody. I'll show you how this office works around here.
Okay.
We got a lady with swollen tumors all over.
Yeah, and she did have surgery, and her cancer marker went down to 300 from like 1200,
Whew.
and
But she had a tumor
now
removed?
it's down to 72.
Oh, good. Good.
But obviously her doctor's trying to still push either chemo or radiation. I have to call her to get it even down because she's saying the inflammation finally went down, and that's why her tumor marker went down.
Well, I mean, they're giving the same acid. So
Right,
she's
so
going to
she's-
have that residual kick where it's going to explode on her again. So she has to just tell her to start doing more deeper fasting and
Right,
stuff.
remember, she was the one that was going to go off to a place and do the fasting.
Oh,
Remember, she
yeah,
was the one with the
yep.
all over tumors. Yeah.
You know what? She needs to go off to a place. She can't do the diet. They're wealthy. They go out and eat all the time.
I know.
And she really needs to hit this hard.
She didn't know if she wants to spend a few minutes with you, maybe tomorrow.
Okay. Yeah, sure.
Okay.
All right. Good morning. How are we this morning? We're loaded with that kind of cases. Tumors all through people, cancer all through them, and serious problems. And this is why I'm proud of you guys for getting into the health and really going after that. Just smart. I mean, and if you are involved and you have cancer, you have anything, go after it. You know, get serious and go after it for a while, and then you'll be in good shape, and then we won't have to deal with it like at these at advanced levels where, you know, your life is hanging in the balance. But, you know, a trip into a better heaven is always probably more fun. Okay, I want to start and kind of catch up. I'm still trying to catch up. I don't think Chris came in here last week, so you'll probably get some up. So let me go on and catch up with some of these question and answers, because I got a bunch more this morning from you, and I really appreciate this. It's not a burden, and I'll get a hold of them. Don't get upset if it's not as timely as you would like, because I'm really doing my best here, and our staff is always busy here. We've always been busy, but that's why I need your help. I need more healers out there that at this level, so we can help those people that are extreme. This isn't those people that have basic problems like arthritis and stuff. These are chronic problems, not to make light of that. You know, these are serious problems in and of themselves, but there's just certain protocols, a certain path. There are some where the life is hanging. Those are the ones that really need the help and the attention, and those people like yourself that's really learning how to do this, because most people are jumping into the allopathic alternative and not making it out of that. Or when they wake up to the reality of what they did out of fear, they're in very serious trouble. No curative remedy allopathically for anything. Remember that. And naturopathically, and I won't say the current naturopathic approach, because the current naturopathic approach in this country is all wrong. It's treatment-based thinking, but with supplements and deficiencies and things like this. It's a wrong approach, as far as I'm concerned, and they're not doing well either. I'm getting a ton of naturopathic clients in here because they were not taught naturopathy. And I know there's a lot of naturopaths that would love to learn true naturopathy. I have a lot of osteopathic friends, and we want to put together a true naturopathy school. And I kind of do that now with these videos and with my school. That's true naturopathy, but with a twist. And that twist is how we turn the use of botanicals or herbs and how we use them to accelerate detoxification and, of course, to help rebuild tissue and enhance cell function, in other words. And so that's what I'd like to see the future be. But, you know, it's going to be whatever it's going to be. Okay. Now, it says anything to look out after 10 years with removed appendix and bowel resection. I might have touched on this. I think I did. and that again would be 10 years. You probably would already see adhesions or heavy scarring by going on this program. You stay raw long enough, any heavy scar tissue, the body will re-eat that up, and adhesions will break down as time goes on, and that sort of thing. But I remember now touching on this. Remember the words interstitial lymphatic constipation. That's what you were dealing with, and that's what hasn't been corrected. So the rest of your bowel walls are up for grabs now. It just keeps breaking down. Wherever you have the weakest cells genetically, those are the places you're going to see broken down. And so that you have to get after. Stomach and bowel formula, whatever for you. I would do lymphatic 1 capsules. If you can handle the GI broom down the road, I do that. Really super clean that area. You always remember the kidneys and adrenals and lymphatics. Always at the core of this. Deworm yourself if you've never dewormed yourself, of course. Go after the health of your body. Maybe clean the liver a little bit. Clean the spleen out a little bit. That's why I love herbs. You can find them for all these different parts of the body. I love that. Where else do you have that? I watch these medical programs. Anybody watch the Bizarre ER? I spent a lot of years in ER and I've seen some things, but the Bizarre ER, man, my own hair was raising on the back of my neck. Oh my God. Some of the things that come in there is amazing. Okay, here's one. Let's see. I can't see who this is. Looks like a gentleman. Says, my wife, 50 years old, 5'6", 109 pounds. She is fairly fit. Low thyroid. She's on Armour Thyroid. And Dr. Jensen fell in, thought Armour Thyroid would be good. So being natural, of course, him and his wife, he put them both on Armour. Well, by the time they came to me, very serious hypothyroidism, very serious parathyroid issues. Can't take these things without losing your thyroid in the long run. Can't take any hormone or steroid, synthetic or natural. Miss the idea of rebuilding tissue, and that's really where this is at. And you can see here in your case here where the parathyroid is involved. Her complaints are spider veins, legs. Okay, so there you go. Leg cramps. See, we're losing calcium and not putting it back. So what we have is not only a thyroid weakness, we have a parathyroid weakness here. You guys are getting this good, by the way. And so you might consider pituitary. Can't hurt to take a pituitary glandular along with this, but might consider pituitary involvement now that you have both of these glands involved here. You might consider that. Like I said, night sweats, that's kidneys, where and maybe get back to the thyroid swinging a little bit, but I can say that when kidney weakness exists, the body oversweats. But again, this could also be tied to the thyroid. Restless leg, there's tied back to the kidneys, the lower back, the inflammation in the spine there gives you the nerve restlessness in the lower legs. So you're back to this lymphatics, the kidneys. Of course, she feels she has many wrinkles. And again, why do we lose connective tissue, the tone of tissue, the tone of the skin, the tone of the uterus, the tone of the bladder? Why do we get prolapsus, the breaking down, the sagging of tissue? Because we're losing the connective tissue. Now, why would we lose connective tissue? Well, calcium is the main component of structure, including connective tissue. And what we see again is in acidosis, the body using calcium as an antacid. Just like why they put it in Tums. It adds to the antacid effect of these issues. And so calcium is one. Remember, calcium and cholesterol, the two main antacids of the human body. And these are the problems you consistently see in an overacid condition. Calcifications from stenosis to the loss of the tissue where calcium was pulled, whether it be joint, bone, connective tissue, doesn't matter. And we also see the plaquing of cholesterol or lipids. And that's what you see in an overacid condition. And you're seeing that here in her case here. Now, these wrinkles can go away. The spider veins can go away. All these things can go away. Matter of fact, it's important that you see your wrinkles go away, that you see your spider and varicose veins go away, or you're not getting it. And when I'm talking about health, I'm talking about health. I'm talking about robustness. And I don't care if you're 95 and I don't care if you're 3 months old. Health is health, and health is involved in the cells of the human body, and the two fluids that take care of those cells are essentially the key focus. It's the only way you can get to your cells. It's that simple. She wishes her hair was thickened like in the olden days. Well, get your lymph moving. Get your, let's see, her big cheat is rice cakes with peanut butter and jelly, organic tortilla chips. She also stresses too much. She worries too much. Zero sun. Well, start getting sun, sweetheart. You got to have sun. People without sun, they don't utilize calcium very good anyway. On top of a parathyroid weakness, you get some sun. All life looks to the sun. Even my dog can't wait to get out and sit in the sun for a while. We all love the sun. Don't try to, we're down here, we got these sunglass wraps where these older people, and I say older people, thank you, they get the wrap around their sunglasses. Never put sunglasses around your eyes. I don't care how bad that sun is. Get your eyes used to that full spectrum lighting. That's a must do. I don't care what you hear out there. Get your body alkaline and get that sun coming in, because without it, you'll go blind. And that's what they found in prisons years ago. Without sunlight, they go blind. That's why they give you 1 hour. Cruel and inhuman treatment. 1 hour of sun in a prison. Not enough. She uses sunblock, chemicals. Oh, please, don't be fearful of God. Look at what you're doing wrong. And what the name here is, extreme acidosis. You see it everywhere in her. She has precancerous cells removed. There you go. Your skin is acidic. You're acidic, sweetheart. Got to fix that, or you can't fix any of these things. Get on a raw food diet. Dump that peanut butter. She's a believer in supplements. Get away from these supplements. Obviously, they're not helping you. Wouldn't be having these problems. And that's the thing. You're on supplements. Why are you still having problems? That's because you're on the wrong focus. Your focus has got to be on your lymph system and pick up these endocrine glands, because you're losing. And you can't come out of this with supplements. You've got to get into the endocrine glands and really pick them up. Get into the adrenals, fix the kidneys, get that pituitary, kicking up the parathyroid and thyroid. Start getting some sun. Take kelp. Kelp would be a great supplement. Clean up your bowels. Get your lymph system moving there. Real important. And make sure those wrinkles go away, okay? Same person here. Let's see. I'm thinking glandulars for thyroid, parathyroid. Smart man. Good move. Think I would definitely put a little pituitary in there just as a popper for these glands. Good move. Probably your new protocol. Yeah, really hit those. You're good. This is perfect. See what I'm saying? You guys are smart. Perfect. Lymph, kidneys moving. Yeah, absolutely there. Big Two helps strengthen her hair growth. You know what? Upper Cirque would be perfect. That's excellent choice. Good man. I mean, you're really listening here, and I love that. I really need to suck that down myself. Any other suggestions? Yeah, no problems taking 3 glandulars, parasite M. Yeah, definitely dewormer. Craving of starches, absolutely. Good take, man. You're really cool. You really make this. You do good. MZIM. Good. Good take. Thanks, Retreat Chef, for your comments there. Appreciate it. I don't know what you mean about sponsors and stuff. Let's see here. Owen Fox, good man. Okay. Let me see here, sweetheart. Pris. I never know how to pronounce some of these words. Remember, I'm an old farm boy here. Bach flower remedies. You asked me about Bach flower remedies. Bach flower remedies. You asked me about Bach flower remedies. I do use flower remedies. I like Fox Mountain. She's a more psychic lady, more in tune. I really like her form. She has a whole bunch of them, including for OBEs and stuff. But she's really got some good products called Fox Mountain. I use her Moonshine Yarrow. Matter of fact, we used them in the Oklahoma bombing. I was working with the mental health clinic down in Naples here, and her husband worked for the State Department. They worked well. She does have her own emergency relief. I used them in the ER when I was working in the ER, and it really does settle you down. She had a lady come in one day, a young girl. She was raped by her father. She was hysterical. She gave her Moonshine Yarrow under the tongue, and she sat down like this and just said, well, what was that? And it just settled her right down. I really love these type of flower essences. For those that have schizophrenia or those that have bipolar problems, get into the flower essences, not these antidepressants and all these type of schizophrenic type medications, you know, and really get into the endocrine glands and stuff. But good question. I love that question. I've been wanting to cover this, and I'm still getting, you know, I'm still working my way through these. But I tell you, excellent question. Look up Fox Mountain. Good stuff there. She's got a lot of great formulas there. Real strong, too. Very spiritual, like I said. Kidney stones. This is a question about kidney stones. Magnesium and B6 preferred real quick. You'll have to ask them. I forget exactly the dosages. I think it's 500 milligrams of magnesium and 50 of B6. I think you'd have to ask the staff here. But I would really get up on those, plug my body just full of juices. I mean, I sucked. I've had them before. I shocked my system when I was a fruitarian and I ate some cooked food, and it just shocked my kidneys so bad they spasmed, and I kicked out some stones. And boy, I just went on orange juice, sucking down orange, fresh squeezed, of course. But you just suck down the fruit juices if you've got them. Get that magnesium and B6. It'll help dissolve those stones. I was going to open up a lithotripsy unit one time, but it's just really go after those with a lot of fruits. They're calcium oxalate stones, common stones there. But again, acidosis is always the issue here. Calcium, you know, in an acid medium binds with other metals and becomes rocks, or it self-ionizes and becomes a rock itself. So this is why that it all goes back to this acid medium and what you can expect in an acid anionic medium. And so this is why reversing that is key to the health and well-being of the human body, and that's what you're all doing. So you're all getting very good with this. I love that. Good questions here. Spinach and stuff like this is all organic oxalates. It's really a process of acidosis and what chemistry does in the acid medium. You can't get rid of all foods with oxalates in them. It's impossible. But you have to the medium that you present chemistry into dictates the effect of chemistry. And the medium is either an anionic or a cationic, or that's a created medium. But in a medium as such, acid or base creates, each has its unique and specific effects. And that's what you're seeing in an acid medium, and you're learning a lot about that. Remember, not only a corrosive medium on one side, but it's an anionic medium on another side. They're almost opposite each other, but they still exist in one. Stop eating meats, dairies, and breads. Could this have been deep tissue detoxification? Yeah, it could have been. Yeah. Oh, yeah. These kidney stones can be buried in the wall, and you can be popping them out for a long time. I popped out 7 of them, and they're not funny. They're really painful for a male, and they're painful for females. No offense, but when a man's been hit upside the you-know-what with a baseball bat, that's what they feel like, and morphine doesn't even get rid of the pain at all. Yeah, I know. I'm glad. Thank you, Exotic Callie. It's sad to see the pain and suffering people go through. It really is the sad of it. Health should be fun, exciting, feel good, except for healing crises. Granted, healing crises are just not much fun there. I'm going to have to cut this off here for a minute. Get to my thing. Canadian War Dog, good man, out of body. I think I met you last night, man. Once again, if you listen, we'll be fine. We'll all be fine as a team. We work together as a team. We got a good team. I think we got a good site here. I appreciate all your views, and you guys keep it up. My thoughts on rebounding is the same. I put this out here a lot. How powerful is it for moving lymph? The raw food communities. They push a lot of that, and it's true that if you're not moving, that lymph gets stagnant, and you can feel it. You can feel that when you fracture, and so movement is key to this. But more passive movement, you have to be careful about producing more acids than your body can eliminate. And if your body's having a hard time eliminating lymph, it's having a hard time eliminating acids. So we get a lot of athletes in here who just really hurt bad, all types of arthritis and stuff, because they're creating acids they can't eliminate. And this is the problem. So you have a balance there that you have to maintain, and I like that balance. Remember, acetylcholine and dopamine go up more in a relaxed state, which turns on elimination. I would say yoga, tai chi, passive, don't overpound, be careful about doing too much rebound. You can't force. This is about kidneys and adrenals not allowing your lymph to properly filter through the kidneys. You can't force that to happen by exercise. I feel it's chemistry. I feel we're at the point where we have to turn on those adrenals, get their kidneys cleaned out, and I feel it's those two. Obviously, I think the pituitary also has something to do with that. I'm not that smart, but certainly the pituitary stem affects urination. So there might be a cross-section there. Colon, do we have an influence on the kidneys and adrenals with the colon? Well, obviously, they were created out of those tissues in the embryonic stages. So, yes, so this is why we go after the endocrine glands, we go after the GI tract, we go after the kidneys, we go after the lymph. You see, when you go after those core things, there's not much you can't cure, because those core things control everything else in the human body. So, I'm going to have to cut off here, and I will continue to catch up. I appreciate your indulgence in these videos. I really do. I thank you so much from the bottom of my heart, and my love surrounds all of you. And please have a fun and enjoy and just be happy today. Have fun, and good luck to everybody out there and having fun and make things work out. All righty, I got to run. Bye bye now. Bye bye, son.